She has been the public voice guiding Minnesotans through the unprecedented health crisis of COVID-19. 1 year since the state first shut down, WCCO speaks one-on-one with Minnesota's health commissioner. Jan Malcolm shares the mistakes made, successes celebrated, and her own personal heartbreak with Liz Collin.
You didn't think a year ago that here we would be a year later in masks, socially distanced, still going through daily death counts and case counts.
No, we could not have imagined, just how disruptive this would be.
The truth is, Commissioner Jan Malcolm was eyeing retirement just months before a global pandemic thrust her into the spotlight.
It's unprecedented.
Her work directs the Minnesota Department of Health and its 1,400 employees with the mission of improving the health of all who call the state home.
Things will change that we can't control.
This last year, her guidance has been both appreciated and attacked by the people she's charged with protecting.
I won't say that it doesn't sting to get the criticisms. My use of social media has changed.
All while a heated campaign season seemed to add more scrutiny.
That was a whole new dimension to trying to manage an infectious disease outbreak, to have to do it through a lens of people not believing the same set of facts.
Still, Malcolm understands the frustrations from so many lives upended.
It's been an enormous human loss.
But it's been that loss of nearly 7,000 Minnesotans from COVID-19 that weighs most on her mind.
We can never stop remembering that all of those numbers are people, loved ones, our parents and spouses and friends and family and colleagues.
The commissioner has friends who lost parents to COVID and in 2020 had plenty of heartbreak of her own with the loss of her spouse in January to cancer and her 90-year-old mother in September. She says in a way the pandemic has helped distract from her own pain.
Shortening the quarantine period.
Her calm, almost comforting delivery, a staple in countless briefings.
There's just so much we didn't know at the beginning that we've learned along the way.
Commissioner Malcolm believes the first mistake was underestimating the role people played who showed no symptoms of the virus.
We thought the role of asymptomatic spread was quite low. And now we know that latest data out of CDC is fully 40 to 50% of the transmission is from people that don't even know they have it.
The combination of that knowledge with inadequate testing and PPE is what MDH blames for high case counts in long-term care facilities, where more than 60% of deaths occurred.
In hindsight, we wish we had long-term care more prominent in our emergency preparedness plan, and that's certainly a powerful lesson learned.
Another regret came in October when cases were climbing.
In the fall surge, I wish that we had acted a little sooner than we did.
The commissioner thinks they waited too long to close restaurants, pause sports, and push people to rethink their holiday plans. More Minnesotans died in that stretch of time from COVID than in any other this last year.
I think we've learned now that when case growth gets to a certain level, it's really easy for it to kind of tip into that exponential growth phase. We just kept hoping it would slow down.
Malcolm points to the CDC when asked if months of mitigation strategies in the state worked. Minnesota recorded lower case counts and death rates than neighboring states, with the death rate similar to Wisconsin. What remains to be seen is fallout from economic struggles and distance learning.
Do you feel like we will look back on that decision someday and think, did we get that right? Was that cost too high?
The immediate reaction to close schools was quite a natural one. To get kids back into in-person learning, getting kids back into school is a huge priority, and we're in much better shape now, and we're very grateful for that.
As we mark 1 year, the commissioner hopes we are a few months away from a real end, with spreading variants the lingering wild card.
Taking a big toll on everyone.
Ready to move on, still touting her familiar plea of personal responsibility to make that possible.
We all have a part to play in making sure that comes true by keeping up our vigilance right now.
In St. Paul, Liz Collin, WCCO 4 News.
Malcolm says that COVID may become one of those viruses that we deal with all the time. So long as it's controlled and not deadly, she says we can handle that, just like how we live with seasonal viruses.